Kimberly Ebrahimi, welcome to the Human Performance Junkies podcast.
Thank you.
It is an honor to have you here. You are an advanced practice registered nurse and a certified family nurse practitioner. I wanted to start off this podcast by giving you kudos and saying thank you. When I was one of your patients about a year and a half ago, I walked into the clinic with I believe it was like a respiratory issue. And after sitting down with the nursing assistant for a few minutes, I was expecting no more than 5 to 10 minutes with either yourself or a physician or physician's assistant. After we got done, I want to say you had taken about 30 to 40 minutes to understand the full breadth of all the symptoms and everything that was going on with my body. And that's when I really felt that you take like a holistic approach to medicine. So thank you for that. I appreciate it.
You're welcome. And yes, that actually was what I would get in trouble for, shall we say, because I would take too much time with patients. But for a patient to truly understand what it is that their condition is and how to manage it and why they need to stay with the medication and the treatments of choice, you have to educate that patient. And if you can't educate that patient, even somebody who's driven to do it, you came in, you knew that you would stick with the therapy. But there are those that come in and they don't. They're coming in because they have to or because they hurt. And if you don't give them explanation, they are not compliant with treatment.
And if you can make that hurting go away, usually once that hurting goes away is when they stop the treatment?
Many times. So, for example, somebody has an upper respiratory infection. They take their antibiotics until they feel fine again, and they quit taking those antibiotics. Well, they really needed to take that full course of antibiotics. And same is true of chronic conditions that you don't even necessarily feel pain with, such as hypertension, heart failure, any of those. I mean, you have to stick with a therapy. These are lifestyle changes. They're not just a quick fix.
Well, good news was that I did stick with my therapy, so thank you for that.
You are welcome.
Tell the viewers a little bit about yourself and how you got into medicine.
So I was 21 when I graduated nursing school, and definitely had a lot of life to learn and live when I came out. Was very, very young, looked incredibly young. So trying to get the trust of my patients was sometimes difficult and challenging, but managed to do that. So I started out in New Mexico and was there for a few years after graduating. And then when I moved here to Las Vegas, I ended up in the critical care arena. I started out in the recovery room and took care of open heart patients, took care of those that had craniotomies, also took care of those that had the simpler procedures like an appendectomy, and got them through that initial recovery phase. Then I moved into the cardiovascular ICU where I really felt like I had more of a niche, because you got to have those same patients for a few days, but it was that after they were having all that pain, and now we have to get them up out of bed, and we have to walk in the hall with all of their cords, wires, tubes, you name it, and they just don't understand. So that's really kind of where my passion for teaching patients about their condition came from, was from the cardiovascular ICU. I then moved on, as anybody moves in a career, into being a program coordinator, where I got the opportunity to work with our local fire department and EMS and help write some of the protocols for our heart attack and stroke patients that we have here in town. A lot of those protocols still exist. I'm sure that they have been updated and modified since I did that. But that was a really exciting time because, again, it's bringing awareness to the public and to the patients and some understanding of how this is integrated, not just in a hospital, but outside of the hospital also. And then I would be able to teach these patients. I also got to teach other nurses, medics, how to recognize these heart attacks and how to respond to them. Then I went into administration, and yes, I loved that as well because I did get to influence nurses, but I really missed that bedside effect. And so then I found myself in school again for nurse practitioner, which is where I am now. So
you had mentioned that you transitioned to that administrative side. Was it eye-opening at that time to see how much insurance companies had influence on the medical system?
Yes. At the time that I transitioned into administration, I did 2 years as an ER director, and then I went into the director of nursing into a rehab facility. And it was amazing, the insurance company's determination of how long a patient gets to stay, even what treatments you could do. You couldn't just say, this person needs an MRI. They had to meet certain criteria, which I felt was taking a lot of control out of physicians, nurse practitioners, and PAs' hands that were making these decisions, specifically in the ER at that time, but even in a rehab facility where you knew they needed longer physical therapy before they could be discharged home. We didn't get to make those decisions. It was because their time with the insurance company was done.
How did that shift your opinion of medicine?
Oh, that really made it so that I wanted to get into a field where I could help patients. And, even as a primary care practitioner, yours, I didn't get to take on medicine the way that I wanted to. That's where functional medicine really gets that opportunity because people do come in, they see me. Now, their insurance, unfortunately, doesn't cover a lot of the visits to me, but we get down to those root causes of what's going on with your condition, whether it's a respiratory issue, it's asthma, it may be high blood pressure even. So those conditions that we typically do treat through a primary care's office, we can get down to that root cause and at least help to mitigate it or avoid it in a functional medicine setting. So
yeah, I feel like you need to take that holistic approach to solve a lot of issues, especially with women nowadays. And we had talked before this about PCOS, autoimmune diseases, and you had also mentioned your Hashimoto's diagnosis over the past year. What is Hashimoto's?
So Hashimoto's is an autoimmune disease, and it is an attack on your thyroid, to just make it very simple. But truly, it starts with antibodies that are against your thyroid. And so lab levels like your TPO antibodies are elevated, and your thyroglobulin, we'll get that one out.
It's a mouthful right there.
It is. Antibodies also are elevated, and many times those are higher before you see a change in thyroid, such as your TSH or your T4s or your T3s, which a lot of people don't even check free T3s, which is the thyroid that is available to your cells to take up for energy. And when those levels aren't checked and these conditions, they're existing long before you're starting to see symptoms.
Is there any way to test before you see symptoms if you're going to have an issue like that?
Not necessarily for something like a Hashimoto's. Obviously, there is for gene mutations, and we're seeing so many things come out lately about many different gene mutations. But if we're looking at stuff like Hashimoto's, that does tend to run in families. So if you have family members that have thyroid conditions, whether it's Hashimoto's or Graves', you can still request a lab level of your TPO antibodies, and that'll give you an indication if you have that specific autoimmune disease. There are many panels out there now that can be run just for general autoimmune, whether or not you have an autoimmune disease in general. And then it's a hunt to find out which one that might be. But people tend to have symptoms that are vague. For Hashimoto's, mine was fatigue and brain fog. And then I noticed that I was losing hair and that gaining weight, even though I was barely eating and exercising. And, it was just, I couldn't understand it.
There are some days I feel like I have Hashimoto's. Fatigue, yeah.
Yes.
Might be hungover too. I don't know which one it is.
Fatigue is one of those very just kind of benign symptoms. Not benign. I guess a better word would be it can lead you down many paths because fatigue is so general. But if you walk in somewhere to say, I have fatigue and it doesn't matter how much I sleep and it doesn't matter how much caffeine I drink or how much B12 I take and I still don't feel any better, that's when you have to start running different labs to see what is going on.
I feel like the thyroid is the root cause of a lot of different issues nowadays.
Yeah, I would say that it definitely is.
What do you see as a nurse practitioner, whether it be environmental factors or dietary choices that most impact the thyroid?
Oh, I think it's both, actually. And I think it's genetics. So everything contributes. We'll just do a general environment. Think of the pesticides that we consume in our food. Think of the air that we breathe when we live in very populated areas, the pollution. And then think of any one of our jobs. Think of our first responders. I mean, especially, you think of all the fires in California. I can only imagine what they were exposed to. All of those exposures put them at risk for thyroid disease.
So I've heard about PFAS. They're perfluorinated substances, and I've read about a correlation between that and PCOS.
Yes. Just like any other autoimmune disease, if you are exposed to this, if you are around anything, it's the inflammation that it causes. So PCOS has 3 or 4 really big root causes to it. And, so anytime you have environmental factors, even for any autoimmune disease, you're going to have inflammation, and it could trigger any one of those autoimmune diseases or conditions. It could even trigger a genetic mutation to respond that otherwise was pretty benign and just living in your body, not really affecting you.
What was the ultimate culprit of that Roundup?
The
weed Roundup.
Yeah.
It was a big lawsuit. They ended up paying out, so I feel like that's when you say you were guilty of something. I wonder if that was...
Yeah, well, pesticides in general, they affect how you process things. They affect, how you, because you ingest them. So now you end up almost with a microbiome that we have to look at, which is your gut health, to see if you have what is called a leaky gut, or is it just the fact that you have these chemicals in your bodies that is really affecting that inflammation. I know everybody says, inflammation's not a big deal, but truly that's one of the biggest root causes for everybody's disease, whether it is hypertension or something like Hashimoto's.
I want to put you on the spot here. So I was reading that women have a fourfold increase likelihood of developing a autoimmune disease. How would you explain that disproportionality?
All right, ready to go into some genetics here?
Sure, yeah. Try to dumb it down for me.
I will dumb it down because I have to dumb it down for myself. While
Sure.
I understand it, I am certainly not a geneticist and genes and chromosomes and all of that. But women have two X chromosomes. Yes, I know that's surprising. Men don't. They have the X and the Y. On X chromosomes, there's what are called myriad proteins that help to develop your immune system. Well, with two X chromosomes, you can see where you would have competing, not necessarily immunity, but competing proteins. You may have a huge immune response. In most people, most women, nature has done its own workaround where it makes one of those chromosomes inactive. But the problem with making that inactive is the fact that you still have RNA, which is our part in our chromosomes that communicate or pass on instructions from one cell to the next. So when you have these RNAs that, are still friends, shall we say, with that X chromosome that is active, then you have that potential for either miscommunication or for extra proteins collecting on the X chromosome, and then you have an immune response. And when you have that severe immune response, you have that higher potential for an autoimmune disease.
Okay.
Sorry.
That was a lot to process.
I know. I was like, oh.
So you're saying the XX chromosome, because that's more common in women, there's a higher likelihood for developing that.
Well, only women have the XX chromosome.
That's true.
So,
some people would debate that.
Right.
Nowadays.
So whether or not, the nature workaround is actually working appropriately or not, but you still have that higher potential because women do have both X chromosomes as opposed to an X and a Y, because those extra myriad proteins are not on the Y chromosome.
Okay, that makes sense. Took me a minute.
Sorry. I probably rushed through that a little too much.
No, I appreciate the in-depth analysis or explanation. You had mentioned gene mutations earlier.
Yes.
One that I have heard slung around by, have you heard of Gary Brecka?
I have not.
He calls himself a human biologist, which, anyway.
I may have to look into that one.
But
okay.
He sells a genetic test that tests for MTHFR gene mutations or just singular gene mutation. I've heard a lot of noise about this particular gene mutation. Can you explain what it is and how it affects you?
Yes, actually, this was another part of my diagnosis that came up this last year. I do have the gene mutation MTHFR. So it is just a mutation that if you have the correct amount of folate in your body, you really don't have a lot of problems with it. But if you have some environmental factors, i.e. stress, even just all the pollutants and all of the chemicals we talked about, pesticides, you can have it where now if you're taking in, say, folic acid, you're not converting it to folate, which is what is available to your body, so that your body then performs its processes correctly and opens up pathways so that stuff like other substances in your body convert to what your body needs to either be an anti-inflammatory or for other processes, shall we say. Then you have...
Such as like methylation.
Yeah, and that's what it is that all of a sudden you're not methylating correctly.
Why is methylation so important in the human body?
Well, that's the conversion of either substances such as a certain vitamin converting to enzymes, or that working pathway for you that makes all of your systems work correctly.
Like homocysteine, for example.
Exactly.
Yeah.
I mean, homocysteine can't be broken down, or it builds up if you don't have your B vitamins breaking down correctly to folate, because then they go in and work with homocysteine and they break that down into either functional molecules. Otherwise, you have that buildup of homocysteine, you have increased inflammation, you increase your risk mostly for cardiovascular disease, but in the situation of MTHFR, you see it associated with Hashimoto's. Again, we're attacking that thyroid. You see it with just general brain fog, but that buildup of homocysteine, being that inflammatory process, is bad. But then you're also not breaking down your B vitamins. So something like B12, you end up with a byproduct that can attack your liver. You may actually have buildup of cyanide in your body.
Doesn't sound good.
No, I personally choose not to have that buildup in my body at this time.
How crucial is it for somebody to know if they have this gene mutation?
I think it's gaining a lot of legs. I think it's going to answer a lot of, why do I feel fatigued? Why do I have these mood swings? We may even, there's starting to, because this is all, like you said, it's kind of that new hot topic that everybody's talking about. But we're seeing it in association with autism and ADHD. And, if we know that at a very young age somebody has MTHFR, we can take those steps to try to mitigate the effects of it.
Because that gene mutation is going to mitigate the production of methionine, are you going to typically see more, I guess, neurotransmitter-related issues, such as like dopamine or serotonin deviation? Like, is that something that you would notice?
It typically doesn't get to that point, and I can use myself as an example. But again, we didn't necessarily check my dopamine and serotonin levels. However, in the sense of the mood swings, several times throughout my adult life, I had tried, because I would have extreme anxiety or even times of depression. And so I have tried SSRIs, which is that serotonin, lifter to help produce that in your body so that your anxiety levels do go down and your depression is not as noticeable. And I would take them, and maybe for a month, once they become effective, I would notice a difference, but then they would seem to quit working. So then I'd wean myself off because I didn't want the side effects that went with just stopping those. And try to figure out what is going on. So perhaps it was more of really affecting those neurotransmitters, but we just didn't see it at that time, because that's not how everybody thinks these days. I'm hoping that, as we progress in the future and actually can focus on functional medicine, that those are things that we start checking on a more regular basis. What metals are present in your body? What are your neurotransmitters looking like? Do you have enough dopamine in your body or in your transmitters to actually be functioning correctly?
Would you say that the mood swings and depression were like the primary symptoms that you had?
No, it was one of those, I look back and I recognized the fact that I had gone through that since my early 20s. where I would not know why I felt depressed. I would even question that. Why do I feel depressed? I have no reason to be depressed. I have a great job. I have a home. I have, family and friends, and there's no reason for me to feel depressed, yet I do. Looking back on that, I could recognize that. What really sent me into checking for all of this was the fact that I was so tired. I was so fatigued. I had never been that person. I was someone who always was the Energizer Bunny, and I, yes, had been sick with COVID and the flu and Epstein-Barr in a 4-month period. And I knew that my body was recovering, but, we were now 5 months after that and still so fatigued and so irritable, and so much brain fog is what I will call it, because there would be times that, with patients, I couldn't think of what medication it was that I needed to prescribe for them, or looking at a lab result, what that really meant. And that was very concerning to me. Even decisions in my personal life I weren't clear. And so I absolutely had to find out what was going on.
So when I make bad personal decisions, I'm going to bank on that then.
Check me for MTHFR.
I just wanted to revisit PCOS a little bit more.
Sure.
I had a listener who wanted me to fully dive into that. But from my understanding, it's basically a hormonal imbalance of the female body. And can you help our listeners explain a little bit more about what's going on, how it's diagnosed? It sounds like it's diagnosed with just a correlation of symptoms.
That's how it starts. And yes, that is the general understanding, is that it's just hormone imbalance. And it is. Typically that is what the issue is. But it's also so much more. You knew that was coming. So yes, the hormone imbalance. What ends up happening is, women tend to potentially be heavier. They have irregular menstrual cycles. They may have facial hair, extra body hair that they can't explain. And so they start really questioning this. Then as they get into that age where, reproduction becomes a key, they want to have a baby, but they can't get pregnant. That's usually the patient that's coming in to see me. I want to get pregnant. I can't. I've always had irregular periods. I've been on birth control pills. I don't understand. But it's so much more. And the root cause can be just hormonal. Mm-hmm. And I don't want to say just hormonal, because that's a big picture. That includes your thyroid. That includes, excess testosterone, not enough estrogen. So there's a lot that goes into that hormonal. Even your DHEA, which everybody thinks of as just a precursor to testosterone, plays a huge role in PCOS, along with cortisol levels. And then, if we want to wrap in around, insulin is a hormone also. It's insulin resistance that's a problem too. So the best way to get to the bottom of what's going on with your PCOS or your listeners' PCOS, that is get a full lab panel with someone who will look at all of those different elements. And then you can start dissecting it from there.
Is there anybody that you recommend for that lab panel? Because
come see me.
Okay. What if these individuals live throughout the United States?
Look for you can ask your primary care. I used to run them as a primary care provider. And so those are definitely people that you can go to. If you are lucky enough to be in a community that has functional medicine providers, go to them. Sometimes OBs will do it. Not always, though. My sister has PCOS, and I have a niece and a nephew, and so she was very successful with her pregnancies, but she battles with everything else, with the weight and with, I would assume, her insulin resistance, but not seeing her labs. But yeah, you just need somebody who's going to be willing to dive into that and really work with you through it, because PCOS is not a you're never going to have kids syndrome. I just had a patient not too long ago that we worked with her hormones, we worked with her insulin resistance, and she is now pregnant. So I just was called yesterday at the office.
2 questions.
Sure.
Outside of the moving target of varying ovulation, which if you cover all your bases, you should be able to hit that.
Yes.
Can you explain to the listeners how the deviation in progesterone and estrogen could affect that fertility?
Well, you need estrogen to help produce your eggs. Yes, typically, I mean, women are born with a set amount of their eggs in their ovaries, but to mature them to ovulation, you need the estrogen. You don't necessarily need the progesterone for that, but you need the progesterone more. I mean, not to say you don't need the progesterone, but you do. But you need the progesterone to help maintain that pregnancy at the very beginning of the pregnancy. So having those in a good balance is important as well.
You had mentioned stress. I think most people can relate to that.
Absolutely.
Everybody has their own sliding scale of what a 10 stress feels like. Cortisol oftentimes gets labeled the bad guy, but there's also good that cortisol can do for your body. When do you want to have cortisol, and how often, and how would you separate acute versus chronic and good versus bad? That was a lot.
Well, we'll first start with how can cortisol be good? And
Perfect.
then we can do the rest. So cortisol is good for when you need that fight or flight response. That is really what cortisol is supposed to be. That stress hormone that you have something that happens and you need to respond right now is when cortisol is a good thing. So because it helps to heighten your awareness, it helps, to increase your heart rate, increase your blood pressure, make you able to get up and run if that's what you need to do. But if you're living at that level all the time, i.e. your cortisol level is up all the time, that's when it becomes a problem. Because cortisol also acts on the liver to secrete glucose into your system so that your cells can take in that glucose for that extra energy for that fight or flight. But if you have all of that extra glucose floating around your body all the time because your cortisol levels are always up, then you have too much glucose for the amount of insulin that you have, or you're excreting so much insulin and your cells just are looking at that glucose going, nope, not today. And then you have insulin resistance. So that's a big part of where cortisol definitely gets its bad name. But it, as you can see, can be for good as well. We have to be balanced, right? So yeah, that's that part of it. But cortisol is also good for waking up in the morning. You want your levels to be higher. That's when you want your levels to be high, is when you're supposed to be getting up. Now, I know we have a lot of shift workers, especially here in Las Vegas, so they work nights. So whatever their morning is considered is when their cortisol levels should be high. This is where we see a lot of problems for those that can't sleep because their cortisol levels don't shift with their work schedules. So that's a tough one there.
I've read somewhere that your circadian rhythm, your melatonin secretion is going to begin roughly 12 hours after the highest peak of cortisol. Is there any science to that?
Oh, yeah, there is.
Okay.
we all think of melatonin as, oh, let's take melatonin so we can go to sleep, which is true. I mean, that is very helpful. It is one of those supplements that you can take to help you to sleep. But the problem with cortisol is if you're in that heightened stress situation all the time, is you end up with adrenal insufficiency, which then maybe your cortisol is peaking at noon and you got up at 6 and you went to work by 8, but you don't come online at work until after lunchtime. And so then that's a problem because then your cortisol levels aren't coming down where they're supposed to, or maybe they are at nighttime and you do go to bed, but you're fighting to get up.
How is blue light on your phone affecting that cortisol?
Oh, that's a tough one. It does increase your cortisol levels. And so, I mean, if you're looking at your phone at 10 p.m. and you should be going to sleep, but you're increasing your cortisol levels, now you're ready to be awake.
Yeah, but I still have to know about, like, I'll go down the rabbit hole of World War II documentaries on YouTube.
Okay.
Not just like 2-3 minutes, like hour-long videos. Mm-hmm. So that's what will keep me up at night. But those aren't stressful. Those will put me to sleep. So that's good.
Yes, but you still have the blue light.
That's true. What about using that filter? So on iPhone, they have like the nighttime filter, and I turn it on 8 p.m. every night.
So it helps, but there's also such thing as sleep hygiene. So sleep hygiene is your bedroom is for two things. And I get patients that laugh at me all the time. It's for sleeping and it's for sex. Period. End of discussion. And I know that sounds really, really funny. But if you think of your bedroom as kind of that sanctuary where you're going to go and you're going to go to sleep, you have to prepare for that. Especially if you're somebody who just can't get it together with when you actually go to bed. And there are many. There are so many people that just don't go to bed at the same time every night. We try to impose that on children with, 8 o'clock is bedtime or whatever time is selected by the parent. And they have a whole routine. We as adults should still follow somewhat of a routine. We should shut off social media and TVs and all of our phones and stuff like that in our bedrooms, because then that helps our body to recognize that it is time to go to sleep. And then there's other routines too, like avoiding caffeine for, anywhere between 5 to 7 hours prior to your selected bedtime. Go ahead. You look like you had something to say.
5 to 7 hours. So I've heard the half-life of caffeine is typically like 4 hours.
Well, it actually varies.
Okay.
It's 1.5 to 9.5 hours.
Wow.
Yeah. So
does that depend on your tolerance to caffeine?
No, it actually depends on how your gastric emptying is going. Because caffeine is absorbed pretty readily in the gut. So if you get rid of your caffeine in an hour and a half, then you should have, in 3 hours, we'll say, and your half-life is an hour and a half. But if it hangs on to it longer, your half-life may be longer.
Okay, so to maximize my quad shot of espresso, empty stomach, that's the way to go.
Yeah, I guess that was the message there.
just try to learn how to maximize the
how to maximize needing to stay awake.
Yeah. I do keep a pretty consistent sleep schedule, mm-hmm. So I've noticed that I can wake up before my alarm now, and I just feel a lot more alert and focused when I do have that consistent sleep schedule. How important is sleep when it comes to stress management?
Well, I mean, just like everything else, it's about inflammation, it's about getting rest, but there's a lot that happens when you're asleep. You actually have immune cells that work harder when you're asleep to improve your immunity. So that's why we always say, make sure you're getting plenty of rest while you're asleep or while you're sick. Well, no, while you're asleep. Make sure you're getting rest.
I know some people don't rest when they sleep.
They're very restless. They're all over the place. But it helps to lower your cortisol levels. Overall, it helps with inflammation. It helps you to be sharper, more alert. Sleep is kind of that time where your body's actually very active because it's healing and where you actually get to heal. It's where you have that response that your body is in that normal zone, specifically in non-REM sleep. Now, in REM sleep, you're going to see heart rates increase, respiratory rates increase. And sadly, this is why you see heart attacks in the morning, is because blood pressures are too high or, whatever other they're breathing and they're not oxygenating well, and because they're breathing too fast or they're not breathing well with like sleep apnea. So
for those individuals who come to you and say, look, Kim, I understand how important sleep is. I really want to, but I can't fall asleep at night. What nighttime routine would you recommend for them to get a good night's sleep?
So for my patients, I typically do get cortisol levels. The best ones to get are either through urine or saliva tests that can be done at home, because it's done 4 times in a day. It's done when you first wake up, later in the morning, afternoon, and evening time, so that we can see if that's part of the problem with sleep. Because if your cortisol levels are peaking at 3 a.m., no wonder you're not sleeping. Or if they're super high at 10 when you're supposed to be going to sleep, then you're not going to be able to fall asleep. So that's one element that I look at. For general, I do encourage people to set a bedtime and then start their routine beforehand.
How far beforehand would you say that routine should
About
start?
a half hour to an hour.
Oh, okay. I was going to expect like 4 hours, but...
Well, it depends on what part of the routine we're looking at.
That's
if we're
true.
looking at, I don't want to consume water because I don't want to get up to go to the bathroom, then, 2 to 3 hours before going to bed is probably the last big glass of water you should be having. If it's, I want to take like a melatonin or an ashwagandha or something along those lines to help calm not just my cortisol and help my adrenals, but also to get ready to go to sleep. The other things you can do are sleepy time teas. And I know that sounds so old-fashioned, but truly it does help. There are teas out there that have lavender, chamomile, valerian root. Some of them even have ashwagandha in them, L-theanine, ginseng. I know everybody's like, ginseng is for mental clarity. It does also kind of help calm your sense also. The other things that you can do is some of the alcohol replacement drinks that are out there right now. They have ashwagandha, L-theanine, ginseng, chamomile, lavender in them. And, the only thing that I caution with that is check the ingredients, make sure that they're not adding a bunch of sugar to it also, and that it's really just those products that are in there.
What is your personal take on melatonin?
So melatonin works, but then I find it after a while, you either have to increase your doses of that, and you can go all the way up to 10 milligrams, but then it tends to not work. It tends to almost work in reverse. So that's why I like those other supplements better. They seem to help calm the cortisol, and they also help to sleep better throughout the night.
Yeah, I've tried melatonin in the past, and typically I'll fall asleep pretty quick, but then within 45 minutes or so, I wake up and I'm ready to go. I'm alert. It's weird. What has been effective for me is ashwagandha, apigen. There's one more, I can't think of it. But, chamomile too. But those seem to ease me into sleep and keep me asleep a little bit better.
Yes. I myself, sleep was a big issue when I was being diagnosed with both the MTHFR and the Hashimoto's. And so now taking ashwagandha and the L-theanine and the ginseng on a routine basis, I have seen a huge difference. Many times those supplements are, they're calming, and they are, but I don't feel like this going from being anxious down to, I'm super calm. What I find is that I sleep through the night. And if I get up, it's truly only because I have to go to the bathroom because I drank my last glass of water too late.
I tend to do that too. I'm like, I need to be hydrated for a workout in the morning, and then I'm up like 2 times and 3 times throughout the night.
So,
what about eating before bed? And here's my argument. When I have like a massive chicken pasta, it will put me out. And I feel great. And I'm like carb loaded up the next day, ready to go. But there's also a lot of research that says like you're going to disrupt your circadian rhythm and sleeping patterns if you have that big meal. What are your thoughts?
And you can, and I've seen it work in both ways. My biggest problem with eating that large meal and going to sleep is especially those people that have GERD, because they lay down and then all of a sudden they have heartburn. Well, they have that heartburn because they lay down and the food or the gases are coming back up into their esophagus. And there's problems with that, that can lead to other things as well. So I don't advise it, but I do see how, anytime I know that I've had a larger meal, I get super sleepy because you're digesting it, and that's where your body's focus is.
You'd mentioned when you're laying down that acid starts to kick up. Is there a better side or back position to sleep on where it won't affect you as much? I've heard on the left side.
Actually, it's on your right side.
It is? Okay.
Yeah,
I did not know that.
Well, because your stomach opens into your small intestines on that right side. But as far as laying down, really after a large meal, laying down is not a good idea regardless. If you can prop yourself up for 2 to 3 hours, that's probably your best.
Actually, I've done that. Just kind of like tilted my shoulders up a little bit, and anyway, that seems to work well for me. So we talked about some teas, some food, eating before bed, kind of just like easing yourself into bed. What can individuals do in the morning to help regulate their circadian rhythm?
Well, hopefully, if they're doing all of this and they're really monitoring and managing their adrenal glands through certain supplements like the ashwagandha and all that we've mentioned just previously, because that really helps with your adrenal glands. Hopefully, then your cortisol levels are actually elevated in the morning like they're supposed to be, so that you are ready to get up and
what can individuals do to actively elevate those cortisol levels?
Well, exercise is always a great way. So starting the morning exercising, because you may still wake up and be groggy. And if you're getting out there and exercising, that definitely helps as an initial. I don't necessarily want to say, go get that cup of coffee, but that is what we all do. And so that does help. It's not necessarily a caffeine equals cortisol, but it's a stimulant, so it does help to stimulate your body.
Cold plunge?
Cold plunge would definitely do it. Especially those of us with Hashimoto's who are so cold sensitive. I'm pretty sure I'd be ready to fight or flight at that point. Though I don't necessarily recommend that first thing in the morning.
Okay. Well, actually, that can be a part of my morning routine sometimes, is getting in the cold plunge right away. I don't know if it's a factor of like doing something mentally difficult right away that starts me off on the right foot, but I just feel so much better throughout the day. what is that mechanism of action that's going on that makes people feel so good when they take cold plunges?
Well, I mean, it definitely is that shock to your body. So you are in that fight or flight for that little bit of time. And then it helps with mental clarity. It does help with metabolism. So you're increasing your metabolism also. It helps, because you are cold, as you do this more often, it can actually get to the point where it's helping you with weight loss because you're now burning that brown fat, which is that visceral fat that we don't want. But you're burning it because you need fuel and energy. So there's definitely some pluses to it, though I'm going to continue to refrain from the cold plunges in the morning.
What about on the other opposite side of the spectrum, saunas?
So saunas also can be very beneficial. Of course, with either one of them, if you have heart conditions or medical conditions that anything shocking can affect in a negative way, you definitely need to consult your provider before you're doing that. But saunas also can be great. I wouldn't do that after a cold plunge because when you drop your body temperature that quickly and that low, you need to more naturally warm up than going and jumping into a sauna where it's going to increase your body temperature fairly quickly. There's a lot of shifting of electrolytes that occur that you don't want to do because then you really can affect your heart rate, your heart rhythm, and that can be a bad result that you don't necessarily want. Nobody wants to do or deal with. But the saunas are great because, you are sweating out impurities and, there are forms of relaxation with that. Time limits should be put on that. I'd say probably 10 minutes max for both of them at each session. And they can be done 3 and 4 times a week. They just need to be alternating.
So I'm a huge fan of the sauna because it's resting cardio for me. Mm-hmm. It's the only kind of cardio I'm going to get. However, I have heard about infertility issues with men.
Yes, men in particular, because unfortunately, just like the rest of the body, when you're in a sauna, their scrotums get really warm as well. And I have no idea what the exact temperature is, but if you're killing off the sperm, because they're stored in the scrotum. And granted, men throughout their life can continue to produce sperm that are new. They're not like women who have a set of eggs and that's it. But still, if you're in that childbearing age, one of the things that most fertility specialists say is make sure to keep that scrotum nice and cool.
So if I continue to go into the sauna, just ice packs on.
If you are that brave, by all means, feel free.
Got it. All right. Well, I'll give that a shot.
I'm like, ooh.
Speaking of other protocols that I like to dabble with, I recently bought, about a year ago, a red light panel. Mm-hmm. Are you familiar with kind of how those impact the body? And help me understand just why I'm sitting in front of a red light for 15 minutes a night.
So red light therapy is an adjunct to a healthy lifestyle. It's definitely not the answer. But it definitely helps to increase collagen production. So if you're doing it for your skin, for collagen production, it also helps men and women that have thinning hair to produce those follicles to grow. It helps with inflammation. So if you have even chronically inflamed muscles, it helps in that respect. So then it helps with pain if it's helping that way. There's other elements of, again, collagen production, wrinkles, trying to think of all of the other
I have noticed
entities.
When I consistently use it on a nightly basis, my skin looks a lot better. Mm-hmm. Obviously, I haven't used it lately, but I do notice a tangible difference.
Yes.
One more topic I wanted to cover, and
Sure.
this is a big one, so It might take a while. gluten.
Gluten.
So there's celiac disease and then gluten sensitivity.
Correct.
Can we explain the differentiation between the two?
So celiac disease, they are 100% allergic to gluten. They need to stay away from that because every time they consume gluten, they are going to have a reaction. And usually it is very uncomfortable. It's a lot of gastric bloating. There can be vomiting, followed by diarrhea. So for them, gluten is a no-go. Sensitivities kind of span so many different things because gluten can be, I don't really want to call it an inflammatory substance that we consume, but truly that's what it boils down to, because maybe it's a sensitivity such as a wheat sensitivity or a barley sensitivity where you're not going to have an allergic reaction to it, but every time that you are exposed to it over and over again, your sensitivity continues to increase. So my brother, for instance, does have a barley allergy. And he started out where he could eat bread. I mean, growing up, I remember watching him eat pasta and sandwiches and all of that. And then he entered his college years and beer became his buddy. And that's when he discovered he had a barley allergy because he just always felt miserable after drinking even just one beer. And so then when we talked a little bit more and he finally went and was tested, he had a barley allergy. So he stays away from anything gluten related at all. So whether it's wheat or barley, he just stays away from that because he just doesn't want to feel that way. But for those, for example, that have Hashimoto's, staying away from gluten is a way to actually help treat it and keep the overall inflammation down to where you're actually absorbing your thyroid medications appropriately, or your TPO isn't climbing, which is that flare of Hashimoto's. So yeah, gluten can be super difficult to It's difficult to manage because not everything out there is gluten-free. And honestly, when you're looking at labels, stuff like, a wheat in something would definitely be a gluten trigger. What's the other one? Fructose is one that you have to stay away from. Anything artificial tends to have gluten in it. But then you start looking at labels and you see gluten in spices and you see it as a preservative in your frozen meats. And you think about breading on, say, a chicken finger or something like that. And, while you're not necessarily looking to eat a chicken finger when you're seeking a healthy diet, look at what kids across America are eating.
It's horrible.
Yeah.
Yeah, it's awful. I look at the diet that I had growing up. I was very fortunate. I grew up in the Midwest, and very commonly for dinner it would be like beef, potato, carrots. I was so happy about that. But we still had Berry Colossal Crunch in the house for breakfast.
Oh yes,
that was my
fortified
jam.
anything.
Yeah, that was great. If people think that they have, let's say, a gluten sensitivity, what type of symptoms would they self-diagnose?
They eat, and sometimes it doesn't have to be the same thing because if it's a sensitivity, it tends to build up. So today you might eat gluten and you're fine. And tomorrow you eat gluten and, well, you might feel a little bit of like a gassy stomach, a little bit of bloating, just feeling super full, because it's just more of a sensitivity. But then tomorrow you eat gluten again and you're like, I'm done. I have the worst stomach ache I've ever had. I look down at my stomach and, I look like I'm 6 months pregnant, and yesterday I had a flat stomach. So there's a lot of symptoms that can go along with that sensitivity.
That bloating feeling I get when I eat Chinese food.
That could be MSG too.
What does MSG do in the body that just wreaks havoc?
It's one of those.
It tastes great.
Oh, it does.
Love MSG.
Oh, yeah. Everybody loves MSG. But it's one of those artificial preservatives that just wreak havoc on our body and almost cause instantaneous inflammation.
Yeah, no, I definitely feel that.
And not just in your stomach. I mean, like, you can look at your ankles and they'll grow.
It gets swollen. Looks like I have diabetes immediately.
Uh-huh.
Yeah, that's... I
swollen,
certainly feel that.
red. You have to kind of consider if you have cellulitis down there all of a sudden. Yeah, no, it's not pretty.
Yeah. Well, I wanted to really thank you for taking the time to do this. Would you mind please mentioning your clinic you're currently working at?
Oh, I would love to. So I work at Spine Up. We're an integrated practice. We're up in the northwest part of Las Vegas off of 95 and Ann. Please feel free, if anybody wants to get those labs drawn, to give the office a call. Do I give a phone number or no?
Sure.
Okay.
Yeah, absolutely.
So it's 702-396-0277.
And is there any way people can get like remote blood work done? Do you guys do anything concierge online?
So we are working on getting that set up, and should have that up and running probably within the next month for sure.
Okay.
Because I know that we have meetings to get that all set up at the clinic.
All
We've
right.
gone through a couple that they didn't work well for us. So we want to make sure that we have what we need for our clients.
Absolutely. All right. Thank you, Kim.
Thank you.